Like and subscribe and click the bell icon to get new video updates.
WA reaches COVID-19 milestone as number of new cases surges past 10,000. Western Australia has recorded 10,182 new cases of COVID-19, the highest number of daily cases since the pandemic began. It follows a previous peak of 9,782 cases in the state yesterday. But Premier Mark McGowan remains steadfast in his belief that the state had achieved a soft landing due to its high vaccination rate and delayed border reopening. There are now 271 people in hospital with the virus, an increase of more than 10% on yesterday's figures, and 9 are in ICU. The state has also reported 6 more deaths of people with COVID dating back to March 28, 4 women and 2 men over the age of 80. Rising case numbers not the whole story. The rise in cases had been predicted, with the chief health officer warning it would occur as a consequence of easing restrictions, including the removal of mask wearing, which happened at the end of last week. Mr McGowan said the government had expected to see an increase in case numbers, but said that figure wasn't the most appropriate to use when assessing where the state is at in its COVID-19 journey. We expected case numbers would perhaps increase a little bit and they relatively flat. They much less than was predicted in the modelling some months ago, he said. The most important thing to look at in all of this is the hospitalisations, particularly intensive care, as that gives us the best indication of the severity of the illness. Premier says WA soft landing unchanged despite the rise in COVID cases. The Premier reiterated the state had achieved a soft landing, after delaying reopening the border due to the Omicron outbreak over East. We have achieved a soft landing, Mr McGowan said. The softest landing in the world, with the best health outcomes and the best economic outcomes of anywhere in the world, with the highest vaccination rates of anywhere in Australia, probably the world. And a community that is well prepared and prepared to adhere to the rules that are in place currently. In February, the state government released Omicron-based modelling that predicted WA would reach a peak of 10,363 cases by late March. The previous peak before cases started to rise this week was recorded on March 29, when WA tallied 9,754 cases. That modelling also predicted there would be around 443 COVID patients in WA hospitals at one time, with 56 of those likely to require intensive care. While there has been a significant jump in hospitalisations in the past 24 hours, from 242 to 271, that figure remains far below those predictions from the state government modelling. Infection numbers expected to fluctuate. Mr McGowan predicted case numbers would continue to bounce around following the removal of restrictions last week. We think it will remain relatively stable, but it will bounce around. The numbers will bounce around, he said. Anyone out there who is concerned, if you want to wear a mask, wear a mask. He pointed to WA's free RAT program, which offers each household 15 free tests, as a possible reason for the rising case numbers. More than half of today's infection figures came from positive rapid antigen tests according to WA Health, with 6,069 cases self-reported and 4,113 confirmed through PCR testing. You've got to remember the case numbers are based on self-reporting, he said. They dependent on people basically logging on and saying they have covered, so as to whether or not people are out there who aren't doing that we don't know, because we can tell. We have provided more RATs to the community than anywhere in Australia, so naturally that is going to mean more RAT testing and therefore more people reporting than anywhere else in Australia, Mr McGowan said. Mr McGowan said WA had reached a third dose vaccination rate for those aged 16 and over of 79.9%. WA has reported 425,704 cases since the COVID-19 pandemic began.